Hi friends, today I have with me Dr. YukeshEswaramurthy. He has a score of 163 in this year's MCI screening. This is his first attempt and he has been able to pass the MCI screening in flying colors. And considering that MCI screening is a very tough exam, while if you look at the last year's MCI screening, it was around 10% passing rate. It's a very tough exam and to pass it in first go is a tremendous achievement. So Yukesh, how are you feeling today and how did you feel after your results?
Yes, sir. I first of all, I like to thank you. At the time of results, I was not in my home. Like I was in my rural area where I had a lot of network issues.
Mm.
And at that moment, I even in my telephone there is no internet. And I asked my dad to check, and both of us are checking for results. At that after seeing those marks, like I was just jumping of joy. I don't know what to do.
I know.
Even my mom is like she was full of tears. Like it's a good feel, sir. I can't express now.
I think, and when you were, abroad, where did you do your graduation from?
From Volgograd State Medical University, Russia.
Russia. And so when you were, in Russia and when you were doing your MBBS, during that time, there would have been, many occasions where you would have felt that, MCI exam is going to happen. Sometimes the seniors would have a good result. Sometimes they might not have good result. How did you, what was going on at the back of your mind through these years about the MCI exam?
Yes, sir. Like as you said, there is a lot of pressure. Like, there is an exam like MCI, which we need to work it for hard. From over years, we need to work for it. Like it is like uh, pressure built on students. After like completing this graduation, I just joined crash course.
Hmm.
For first few days I was like I felt very tough to catch it up because I was like just an average student. Like it's crash course is like bit a little difficult to catch it. And then I personally messaged help desk, and they started like they send notes for all 19 subjects, and which include rapid revision and a question bank, which helped me a lot in preparation. And, and especially like recorded videos, it's like decrease the load. Like we can see whenever or whatever we need for preparations.
Yeah. And any particular teachers that come to your mind today when you look back and any teachers whose classes you found particularly useful?
Yes, sir. From starting like Surya sir, uh, and JP sir, Thiru sir, Achin sir, and Tushar sir, and even for radiology, it's and Siddharth sir. It's good. They helped me a lot, like making revisions, and also they shared the personal numbers, like we can ask our doubts whenever we need. Thank you for each and every faculty there.
But we are so happy that we could be a part of your journey, and we are so happy that now you are successfully on the other side. Any ideas about future also, like now that, so far you were always thinking about MCI, but now MCI is done and dusted. Now you planning something more about future as well?
Um, yes, sir. Like I need to do internship. After now, my parents are also looking for it, and I'm also searching for a do internship. And after that, mm, making next move like making a INI-CET or a NEET PG.
Great. So, do you feel that, like I think this is a good message that we can give to aspiring foreign medical graduates also, that a lot of students when they come to DAMS for MCA screening, what I've seen is they go on to go forward and continue their preparation for PG entrance also. And this year, we had a few students from our MCA screening batch who went on to do PG courses, and they some of them actually got into INI-CET as well. So what I want from your side is that do you think that now that you have given the exam and you have passed, do you think that hype was too much and the paper is not so tough? Actually, with the correct guidance, you can do it easily.
Yes, sir. When compared to previous paper, it's because previous paper was full of clinical and it's like it's very difficult. When compared to it, this paper is a bit easy, but it's not like too much easy. It's a moderate paper.
Yeah. Yes, perfect. This was not a easy paper, I would say, but this was like, say, there were some topics which were given which were easy to do, so that you could gain some marks. Last time it was more on the tougher side, I think. So that is
Yes,
there.
sir, of course. And even in mock test also there is questions like which is more than the level of FMG
Yeah.
for this exam.
Our purpose was there so that you don't get scared in the real exam. So, I also wanted to know that did you also attend the integrated sessions that we conducted DBT, and were you happy with the way we could do a system-wise integration for you?
Yes, sir. It's like it was a new experience for me. It's very first time I have attended DVD sessions, and it's like more integrated. Like doing same topic from every subject. It's like different feel, and which is very easy for revision and made easy. Uh, Revision made easy.
Yeah, and I
It's
met a
very
lot of students who find that the part two paper this year was, of the style of the DBT, like part two paper was uh, more scoring this time.
yes,
And
sir. It's like integrated, and DVT helped very much in that.
And were you happy with the level of questions that were there in the mock test that we conducted in the MCI? Do you feel that we prepared you very well for any kind of paper? Because last year paper was very tough.
Yes, sir. The actually after attending the mock test, I was like, uh, I have no hope in exam. Like, oh, I need to work very hard for this because the mock test is super tough.
Yeah, but if you notice that the last year's paper was very tough, so we wanted to make sure that we keep you on your toes. And we've already started to analyze this year's paper. I want some more ideas of this year's paper. Was which part was more tough, part one or part two?
Actually, when compared to me, part one is better than part two because it's like lot of questions are from a lot of questions are direct, and we can make it. And even those image based questions, it's like decrease the pressure over there.
Yeah.
Yes, and
Okay.
also save time for us.
How many image-based question would be there in this year's paper out of 300 if we do a guess?
It's around probably around 30 to 40. Like I'm not sure about it.
Yeah, yeah, I think around 30 to 40 would be visual. That's good. And how many questions would be one-liners and how many questions would be clinical in style? Because I think future aspirants, when they listen to you, they want to know the exact from your side rather than the rumors. Huh?
Yes, sir. There are a lot of direct questions, and also even clinical questions. Also, they are not much bigger. Like it's just 2 to 3 questions, 2 to 3 lines, and also there is a lot of clues in it. So it is not like much difficult to understand the questions, or like we should take a lot of time for each questions. It's that good, which when compared to last paper, it's very good.
Yeah, great. And Yokesh, I also want to know from you now that when you told your result to your parents, okay, and today when you meet them, do you feel the pride in their eyes or happiness that you have increased their happiness by passing this exam? Do you feel that?
Yes, sir. I felt personally because um, they are like they are calling relatives and friends like my son passed the exam. It's a
Yeah.
good feedback.
And I think now that when you pass, you feel that it was worth it to do some hard work, because when you see the happiness that you have generated for them, I think it was worth that you put in the hard work to pass the exam in first attempt. Because even they must have the stress because they keep hearing from people that the pass rate is less, paper is tough.
Hello.
Yes, beta. So we were discussing, that parents are the one who feel the most joy at this point, I think, because they are also stressed because of this exam.
Yes, sir. Because we are, I'm working in, like I'm sitting in home and just looking at the systems or looking at notes for day and night. They are like, okay, they are like helping me a lot by encouraging support, and now they also feel a bit relief.
And
And
Yukesh, yes, Yukesh, you will be happy to know that now we have started our DAMS Ultimate Live course, which can be accessed by students anywhere in the world through the app, so that people can actually start studying earlier also. Because I feel that this exam is not tough. The only thing is that you need to be exposed to the style of teaching that is required for this exam earlier. Uh, so now we have come up with that solution. And another thing that we have come up with is we have come up with a pre-recorded crash course for the upcoming exam also. So maybe if some of your friends would want to know. And from on this note, Yokesh, now I want you to tell us, about the mindset. Because we've studied, we asked you about everything, but it would not have been easy these 5 years. Although right now you're making it very easy by telling it in simple words, but there would have been pressures. Someday, even Yukesh would have thought, "Ki nahi hoga MCI, yaar, I want to, nahi, I can't study." But how did you manage those ups and downs?
like it's like my seniors helped me a lot in this. uh, they're like, it's not about, it's not like it is never doable, you can do it, come on, you can do it, like that. They encouraged me a lot. And after, for preparation also, it's like, okay. And at the time of exam, it is like, what, we should never get tense in exam hall. I felt right at that time of exam, because the very first 10 questions, I have no idea about it. At 9 o'clock, I'm sitting in an exam hall, and very first 10 questions, I don't know what is that. Okay, let's go. Let's see next questions. Like, it's like we should wait for our ball to hit.
That's absolutely correct. Sometimes what happens is I see students when they see 4 or 5 questions in continuity that they don't know, they sometimes panic and they black out and they destroy their own exam. While sometimes after that there will be questions that you will be knowing. So it is always good to have a cool, calm mind. And if you have a good bunch of friends and families buffer, it always helps to support. Any message that you want to give to future Damsonians who will be appearing for MCA screening in the mid-year exam?
Yes, like, it is not like never doable. It's just we need to choose our path in right way, and we should work for it. That's the thing. And like, we should not get depressed. Like, we should approach in positive way. That's it.
Thank you, Yukesh. Keep choose your path, keep working hard, stay positive, have a good bunch of positive friends. It is all possible. Don't be too scared if you are right now abroad and thinking about MCA screening. And I also want to let the students know in who are right now in abroad in various years that in future, in very near future, MCA screening will be replaced by next. So it is always a good idea to start preparing early. The exam will be more clinical. Like this year, also the paper was more clinical. The only thing was the question length this time was smaller than the previous exam, so it was time management was not an issue, but the paper was not easy. They are not asking easy things. It is like moderate. You need to have concepts. That is the gist of the preparation. On this note, Yukesh, I wish you all the best. Convey my congratulations to your parents. God bless you, and keep working hard and keep achieving more and more in life. God bless you, beta.
Thank you so much.
Bye, beta.